Thursday, so today is always a crazy day. We have a staff meeting this afternoon, well, at lunchtime, so we'll try to get lots of things. This little one's going to get spayed. She's coming from the Humane Society, found a new home. And then we'll get lots of appointments in, and then we'll close down for about 2 hours, and we have an expert coming in to talk to us about low stress handling and fear-free practices. And so it should be a real productive meeting. We try to meet once a week because it's really important for all of us to communicate and to learn some things and get along with each other and make sure everything's flowing well.
We're taking a look at little Bella here. Her mom and dad found a little spot on the side of her face. They don't know if she got bitten by something. We'll try to lift her little neck up. It's kind of sensitive to her.
Yeah.
It's very red and inflamed and very sensitive to the touch, as you can see there. And the skin, the tissue under it is very swollen and inflamed. It doesn't seem like it's just swollen probably from irritation and inflammation.
Yeah.
So we will...
I think that happened.
Usually with that, it's what we call a hot spot, which is moist dermatitis. A lot of times it's self-inflicted from where they scratch. So she may have had some kind of little tick bite or flea bite or some other irritation that she just scratched and made more raw than normal. A lot of times, especially in that location, we worry about it being an ear infection, but her ears look fine. So I don't know if she got bitten by some kind of insect that caused the irritation, but some kind of it's a secondary problem to an inflammation that she traumatized her skin there.
So if you have a dog with long hair, you probably should check them regularly and see.
Absolutely. Which she's got a nice little haircut here, so it's easy to see things on her. But she is an inside dog. She goes outside just to potty and come right back inside. So she's not the kind of dog that you would think that would be covered with with external parasites or something, but it definitely, this is a pretty classic hot spot that's usually self-inflicted from some irritation that they had. So we'll get her, sometimes we can treat them topically, but with as much swelling as she has under the skin there, we're probably going to put her on some oral medication and some oral steroids to help with the inflammation and discomfort for her to get her feeling better a little bit more quickly. The other thing with hot spots, a lot of times we like to use the e-collar, which is a cone of shame, as a lot of people call it. But with this location, I think that she's just gonna push that collar right up. So I don't know if we're gonna be able to help this situation with the e-collar. Plus, she's probably gonna be pretty pitiful with the e-collar. So we'll try to avoid an e-collar with her if possible, and get her on some medicine that'll help with that inflammation.
Okay.
What's up, Doc?
You guys ready for the meeting this afternoon?
Yeah.
Yeah?
Yeah.
Excited about it?
Yeah.
Yeah?
We get lunch.
Yeah.
Okay. That's okay. Here's the question: what is the meeting about?
Peggy from Seva's coming, right?
Yeah, that's all I know.
That's all I know.
But so nobody knows exactly what the meeting is about. No. Maybe question number 2. Do you know exactly what you're getting for lunch?
Oh yeah.
Yes.
All right, so this little girl's came in to be spayed today. She came from the Humane Society, so we don't know where she came from. But if we're clipping her and prepping her for surgery, I don't know if you can see this. You have to get in real close and take a look at her belly. This is her belly button. This is her pubis. So I measure like this is right where I would do the spay incision. And can you see that on the film? There's a scar there. And that's our clue that she's been spayed before. So we don't know for sure. We just know she has a scar on her belly from surgery. We're going to scan her to see if she's had a microchip implanted. So, nothing there. So we don't know who this dog is or how she got spayed, but I think she's been spayed before, and we'll wait and see and give her 6 months to see if she comes into heat. So she may have had a collar and it came off, but she ended up at the shelter and nobody knows who she is. So this is the value of having a microchip implanted when you have your dog spayed. Pinky?
This is Pinky.
Oh.
Pinky is looking for a home, I understand.
Oh, she's cute.
But we're trying to find out if she's pregnant first, because she's supposed to be at the Humane Society, the Caswell County shelter, and they're wanting to get her spayed before she finds a new home, but they're afraid she might be pregnant, and they don't want to abort her puppies if that's the case. So we're just trying to figure out yes or no on that, and we'll hopefully it'll be a no, so she can get spayed and find a permanent home.
Mm-hmm. How are we gonna find out?
We are gonna ultrasound her. So
Ah.
first, we actually have to shave her belly.
Okay.
Can we share your?
I can move him in. Her.
Move her. Let's see how
There
much
you
hair
go.
you have on your belly.
What did you say the other one's name was?
Gordy, I think. Typically with ultrasound, for a full abdominal ultrasound, when we're trying to evaluate liver, spleen, and everything, we go all the way up to the sternum. But with her, we're not going to shave quite as much because we're just trying to get her uterus today.
Pretty girl. What do you say, Pinky? What do you say? She's a good girl. Seen any puppies yet?
I've not seen anything too exciting yet. No puppies yet.
It's a pretty harmless way to look, though. It's
Yeah,
really
definitely. It's nice.
Nice piece of equipment we got here.
That it is.
Gypsy! Gypsy! You're so cute! You're so cute! You're so cute! You're so cute!
This is sweet, baby. This is
Is
sweet.
she just a puppy?
This is sweet. Yes, this is her second time.
Yeah, how's she doing? She's still learning to have a haircut?
She's still learning, but she's doing
Yeah.
good. She's getting her blueberry facial today.
Oh, what's the blueberry facial?
It's a massage of a blue shampoo, and you put it on their face and let it sit, and it helps to get the eye goop, everything.
Oh,
It
yeah.
helps to work that up really good so it comes off the face.
But it smells good when they're kissing you in the face, too.
It does, like
Uh-huh.
blueberries.
And so what is she, a poodle? She's a poodle mix.
Poodle mix.
Yeah,
Some kind of
she's a
poodle
really cute.
mix. But I'm a sweet baby. Yes, I'm a sweet baby.
Let's go see what's going on in day camp.
You guys getting your hair dried? You look pretty. You had a bath. You know it right, you're pretty too. Oh, yes, you're pretty. It's okay. It's okay. Whose toy is this? Whose toy is this? You like the toy? Get it? You get it? You get it? You get it? You don't want it? Beautiful day out here today. Beautiful. You see that camera? Get it. Come up here and get it. Come up here and get it. Come on. What do you say, pretty girl? What do you say, pretty baby? Come here, Kuchan. Come over here, buddy. Come over here. Come over here. Come and see me. Come on. Oh, come on. Want a treat? Want a cookie? Oh, you guys like it. You guys like it. Try to get Kuchan to be friends. You're friends with everybody, I bet. Yeah, you're cute. You're cute too. You just got your haircut, looks like. You're super cute. Come here. Look. Now bring my treats out here. I need to bring my treats. What's that, baby? How are you? He's the only one that fetched?
Yeah. Him and Tate takes my hair.
Playing keep away now.
Oh yeah.
Bring it here. Bring it here. Come on. I want to throw it.
Everybody wants it.
I don't know.
Do I give it? Thanks.
Chandler's not here, but he normally will snatch anything Moses has right out from under as soon as he drops it. So
You're next.
I think he assumes that these other dogs are going to do that as well.
He's headed out there to get it already.
Bring it closer.
I've got 625 months left to live.
Let's hope he lives to be 105.
You gonna stay for lunch?
I might. What's
All
the
right.
topic today?
It's fear-free and low stress handling,
Reading body language
reading body language
of animals.
of animals.
Yeah, that sounds good to me. I think I might.
All right.
I've already eaten. Don't worry.
I got chicken salad. Probably do that. I had a big.
And people will get, while their dog is here, of course, we'll take pictures just like we've been doing. Pet Hotel already does a great job taking cute pictures with them. You know, we'll have the little party hats. We also have, Emma picked these up for us, which are really cute for the dogs that will wear them.
Right.
We have a bandana. We have boys and girls. So, you know, whichever one they are. So basically, with the birthday package, they'll get the bandana. We can put that on for their photos. And then all their little friends will participate in their group. We do need to make it very clear because some people get confused. Why is my dog not at the birthday party? We got to make sure that they understand it'll be with their group. So not everybody is always going to be participating. We also have little cakes, little pup pies, and they're already kind of cut into little slices. This is like a little birthday cake, so you know their little friends can share in their birthday cake and party. We also have now a little chalkboard sign, so we can use our little chalkboard markers to write their name and hang this under the happy birthday banner. You know, happy birthday Tate or whoever it is. And then for them to take home, they get to take home their birthday bandana. And then they also are going to go home with a little bag that has a little toy in it. We have a couple different toys. Little birthday cake. And then they also have a little baggie with some lean treats and just a couple of milk bones in there as well for them to go home with. So basically the party is going to include, you know, we'll post some pictures of it on Facebook. They'll get their birthday cake, they'll get a bandana to take home, and then they'll also get a birthday gift to go home with. And for anybody who doesn't want to do that, if it's their birthday, we are still going to do just a simple birthday photo. We'll print it, put it in the little frame, and that will be complimentary. So that way, everybody who has a birthday gets something and is still feeling special and not like, oh, well, now they just want me to pay for it. But then you can get the upgraded package. And if it takes off really well, we have some ideas for like a premium birthday package, but we'll have to see how this goes first. Awesome. Right?
Mine out. And I think it's a really good example of something that I could have done differently. There was a morning that we were super busy and just going like back to back into rooms, and we had a new client that was there with her 2 dogs for nail trims, which is a pretty simple appointment. And Dr. Org and I went right in and did it, but the owner had communicated to me that one of the dogs might actually be a little bit like bratty for the nail trim and may try to bite or something, and I didn't take a second to slow down. We went right in there, and I didn't communicate that to Dr. Rory. Everything went fine, but afterwards I was like, it probably would have been better to take a second and talk, even though it's a straightforward appointment. It's a new client, so we don't have pre-existing emotional records. And that's something to keep in mind too, is making sure to ask the client how their dog typically does for things if it's their first time with us, making note of that and communicating it to everyone that's going to be interacting with that animal. So, yeah, even better. Yeah, awesome. I could do that.
It's one of those customer service things where I don't want to take it off. That in itself is a trigger point. Removing and putting on and removing a bandana, putting something else around that dog's neck. That can be a trigger for a dog, and so it just depends on that client.
Well, and the car ride itself is a huge trigger for a lot of dogs. So.
Well, maybe you could be like, you know, here's a bottle of Adapter, you can spray that next time before you come.
Absolutely. And so if they're responding and you are getting responses like Sophia said, we notice a difference, that's a huge alert red flag. That is a If you know your dog gets good results with Adaptil, having that client use a collar during heavy thunderstorm season, and then, you know, we had thunderstorms a couple weeks ago, right? And so it's gonna pop up during non-thunderstorm season, but we can deal with that, we can supplementally use. And then during really, really stressful situations, or potentially really long ones, give them as much as they possibly need, because the more stress and the higher the stress level, the more they burn through pheromones. You need to constantly tell your amygdala to not have a fear response. Calm down.
Except for the one at the top. I don't know. I may not want that in the commercial.
Yeah, I'll say maybe not so much this one that you guys see here a lot, but you're seeing these two, right? So fear, aggression for sure. So fear, aggression, and what are these dogs saying? What is that pity saying?
Please don't touch me.
Yep, back off, I'm scared. Please don't come near me. This one even more so. I'm backed into the corner.
That one.
So it's very common.
There's the.
What is it? What is it? He gets. Oh, you saying it? You saying it? Oh, hello. You are. Oh, Boozy. It just smells bad. You can't eat it.